For the past about 5 or 6 years, I've experienced sinus infections on a regular basis, probably 2 to 3 times a year, having to take antibiotics to clear it up, and sooner or later it comes back. I came to Dr. Trimble, and he actually did a CT scan of my sinus area, and then he decided that maybe the balloon sinuplasty would be a good procedure for me to give me relief from the pressure that was in my sinus cavities.
I think the ideal candidate is someone who gets more than 2 to 3 sinus infections a year. You know, the more traditional treatment options are still available. I mean, these patients can still go back to the operating room at a future date if need be. For those who don't want to go to the operating room, this is a great procedure because it allows us to do something in the office that we've never been able to do before, and that's open up the major sinuses in the head. You come into the examination room, we place you in the chair. The nose is then topically anesthetized and decongested, and that takes usually a couple of sprays over a period of about 20 minutes. And then I go in and I actually place cotton balls soaked with topical anesthetic in the areas that we're going to be treating. There are some injections, but it's such a small amount of injection that most people never even feel the needle. After that, the patient's then transferred to the treatment room, then the procedure begins. This is actually the guide catheter right there that actually goes up into the nose. That wire is what actually threads into the sinus, and once we've localized the sinus, then the balloon can actually be placed into the sinus, and then once the balloon is in, we'll actually blow up the balloon. That actually fractures the bone around the opening of the sinus, and that's how the sinus maintains its openness over time.
I was surprised how simple, how painless the whole procedure was. It was very minimal. From start to finish, the procedure was very easy.